Did you know hair loss is reversible and preventable for both men and women?
Hi, it's Dr. K at Refresh Med Spa LA. And guess what? We have excellent hair restoration without surgery that's great for both men and women. Stay tuned and see if you might be a possible candidate. Okay, so you've been looking in the mirror and you see your hair has gotten thinner or it's always been thin, and you're starting to wonder, what can I do about it? Or perhaps you had a great set of hair and now that top area of your head is starting to get a little more shiny. All right, so let's just jump into this because really you're here to find out what kind of non surgical options there are to get some of that hair back. And quite frankly, I want to talk to you mostly about Keralase because, in our experience as hair restoration specialists, we're finding that this is probably the most effective method out there. So this is going to be a laser assisted hair regrowth system. Your other options are things like PRP with microneedling. We still do that. We've been doing that for a long time. We know it works really well. You also have the option of using exosomes. Those can sometimes be challenging to find depending on your provider. You also have options for scalp tattoos. Yeah, I know that sounds interesting and weird, but it's a thing. Some people elect to have just little tattoos placed on their head. You also have the ability to use LLLT, which is low level laser therapy. You've seen those red light hats. Those have their place in hair restoration as well. And obviously, topicals and prescription medications such as minoxidil, finasteride, Rogaine, those kind of things. To give you a little better understanding of how we lose hair and why these treatments are effective, it's time to dive into the biology behind this. And I want you to remember a three-letter acronym, DHT. It stands for dihydrotestosterone. Basically, this is the bad version of testosterone, which is converted from regular testosterone into DHT. And this DHT is one of the primary reasons why people end up losing their hair or getting their hair thinned out. And what happens is these DHT molecules end up attacking the hair root where the bulb is. And by attacking the hair root, they start to kill off the hair cells. And that's where we start to run into trouble. Now, the important thing is the hair doesn't just suddenly keel over and die. What happens, it first becomes micronized. It kind of turns back into that peach fuzz that we had as little babies. If we are still at that stage, we have a chance to be able to still help you with non-surgical methods. But once it's gone bald, where there's literally nothing, meaning the bulldozers came through the forest and just mowed everything down, you're probably looking at a surgical option. So now we know that DHT is one of the big reasons people start to have thinning hair. But what are some of the other reasons? There's things like telogen effluvium. This is basically stress induced hair loss. Traction alopecia. So those of you who have their hair in a tight ponytail or you have really tight braids, you're at risk for having uh, excessive pulling on the hair. And this can even happen with people that have weaves and tight braids. So you want to ease those up if you can. Also, there could be nutritional deficiencies like your iron, protein, vitamins, those kind of things. Hormonal changes such as pregnancy, menopause, thyroid issues, and also chemical reasons like if you've had hair treatments like bleaches, colors, and perms, those can all affect your hair growth. All right, guys, so this is my favorite part. We're going to talk about Keralase. So, what the heck is Keralase? Well, Keralase is a combination of a very powerful laser from LaserMD, and we combine that with the potent growth factors that come from Kerafactor and create a substance and treatment that is highly effective. Let's go ahead and talk about how does Keralase work. So step one is preparation of the scalp. And what we do is we use this powerful laser, which lays down little teeny tiny dots of energy along the scalp. And imagine kind of like putting little drilled holes in the scalp. And what this does is it prepares the scalp to accept the Carafactor solution that's going to go on next. And this step, this very first step that's so important, is done painlessly. I'm not kidding with you. I've had this treatment myself several times, and I am an absolute wuss. And it is practically painless. You barely feel the laser on your scalp, but it is such a critical part of this treatment that makes it so highly effective. After the laser has done its magic and laid down those little teeny tiny microchannels in the scalp, it's time to go ahead and apply the Carafactor, which is a specially formulated growth factor serum that is biomimetic, meaning that this is similarly active ingredients to what your body already has, except what we have done is taken out the components that cause hair to slow down and left behind only the components that help the hair to grow. And this is one thing that kind of sets Care Factor apart from things like PRP, in that, believe it or not, as amazing as PRP is, and it's made of your own body's material, and it has lots of growth factors, there are actually inhibitory factors that come along with it as well. So now you have a competition between your growth factors and these inhibitory factors. And what you want to do is eliminate the inhibitory factors, which is the beauty of what Carafactor has done here. And by laying down those microchannels with the laser, now this Carafactor can actually get deep down into the roots where those bulbs are and have a potent effect on helping your hair to grow. Okay, step three. This is for all you science nerds out there. And this is one of the coolest things about Carafactor. So they have developed Carafactor to go into something called nanofluorosomes. Imagine if you had a bubble maker, and this bubble maker, you were able to put inside each bubble the Carafactor. So this is a very precious cargo that this bubble is now carrying. And the beauty of it is that these little bubbles, instead of just sitting on your scalp, have a tendency to be attracted to these microchannels that laser made, and they actually try to dig further and go down into your scalp. And they don't just release their contents wherever. Once they get down to the scalp where the bulb is, that's where the magic happens. And this is done by something called red light therapy. So when we put a red light therapy on your scalp during this treatment, what it does is it actually activates these nanofluorosomes, and then they release the Carafactor. That special cargo inside those bubbles actually get released inside the scalp and are activated by the light to be released, and they get to do all their magic in the scalp, which is genius, because the last thing you want is all this Carafactor to be sitting on top of your scalp where there's no hair bulbs. You're not going to grow hair from the dead skin on the outside of your scalp. You want this stuff inside, and you want it to get activated once it's actually by those hair bulbs. How cool is that? So now we got to find out who is a good candidate for non-surgical hair restoration versus surgery. And as far as we're concerned, if you've got some fuzz left on your head, you're probably a candidate, meaning that if you had a forest full of hair and the lumberjacks came in and they randomly picked off some hair here and some hair there, you're probably okay. But if you had the bulldozers come through and just mow down and give you squeaky clean skin, you're probably looking at a surgical option. Let's consider some of the benefits of Keralase and why you would choose this over a surgical option such as hair transplants. For one thing, the non surgical option gives you a very easy route of administration, meaning that there's no incisions, there are no stitches, your head doesn't look like a matchstick, and no one needs to know that you had any kind of a treatment done at all. You also are going to get improved hair growth. The combination of the laser treatment along with the Carafactor growth serum enhances those hair follicles to start growing your own hair back. You don't need to grab it from somewhere else. On top of that, you get better scalp health. So, we've seen a lot of people, for example, with dandruff and other dermatitis issues with their scalp, have a lot of improvement just from using the specialized shampoos and conditioners that we have. And you practically have no downtime. I know we call it minimal downtime, but I'd really like to call it no downtime. I mean, other than having a little bit of solution on your scalp, there's really no downtime involved with this. Let's talk about the hair growth cycle and what Keralase does. So, in the hair growth cycles, there's four stages. You have anagen, which is the growth phase; catagen, which is kind of this transitional phase where it's not growing or doing anything; and then you have telogen, which is its resting phase; and finally, exogen, which is the shedding stage. And what care factor does is it helps the follicles of the hair to be stimulated and get into that anagen or growth phase, and it helps to strengthen up the hair, and it helps also to improve the overall quality and thickness and density of that hair. I want to take a few minutes and share some success stories with you guys as well. For example, check out this 35-year-old lady. She started to lose her hair after her first pregnancy at the age of 31. And she never really quite got back to where she originally was. And this was just agonizing for her. Now, about 12 months after her last session, you can see for yourself the kind of growth that she's had in that front corner of her hair. It was just kind of gone. And now she's got a full set of hair back in that front area of her hair. This gentleman, 60 years old, he's had 4 sessions of Keralase, and look at how well he's done. He's only got a couple more sessions to go before he gets into his maintenance sessions, but he started to use his Carafactor serum along with the Carafactor shampoo at home. He's also using his topical DHT blockers and taking the appropriate vitamins, and he's being able to maintain this hair that he's grown back. This is all his own hair. There's no surgery involved. This is one of my favorite stories. This gentleman, 67-year-old guy, what a great guy. He basically had given up hope on his hair. And the worst part about it is he's a hairstylist and he's got his hair missing and he has an image to keep up. He's had only a few sessions of Keralase, has had significant growth, has few more sessions to go before he gets into his maintenance sessions. And look at the remarkable treatment that this man has had. He is so happy. Story on this young lady is that she's always had thin hair. Even in her 20s, it drove her nuts because she was trying to do everything she can to style her hair this way and that way. And with the thin hair that she had and just missing trees in the forest, it was really frustrating for her. And she found that the Keralase started to really thicken up her existing hair. The little peach fuzz that she has that was not visible started to grow out and started to get a full set of hair, which is what she always wanted. So, just to summarize everything we've been talking about, you have your surgical options. I mean, you could hop on a flight and go to Turkey and get your hair taken care of and go on a tour as well. But you're going to come back looking like a matchstick and everyone's going to know you did something. Or you can go through a non surgical intervention like PRP, exosomes, which we love and we've been doing for so long. Or now we can get into Keralase, which we've discovered is doing such an amazing job and, quite frankly, is my preference for all of my clients that come in to get them on Keralase because we've found so much success with this. So just some friendly advice from Dr. K here at Refresh Med Spa LA. Please come and see us while you still have a few trees in the forest. Don't let the bulldozer come by and remove all your hair because I can't help you at that point. Go ahead and either call us, visit our website. We'd be happy to get you in and get you an evaluation and let you know if you'd be a logical candidate for this treatment. We've had a lot of success and I'd like to do that for you as well.